So today we're going to be talking about oral ties or oral restrictions. These are usually assessed and diagnosed in infants or babies. Oral ties are typically defined by shortened, tightened, or thickened frenulums. So frenulums are a normal anatomical structure that it is the piece of tissue that connects your tongue to the bottom of your mouth, as well as the lip to your gums, and then the cheeks to your gums. So these are normal, like I was saying. However, sometimes when they become shortened, tightened, or thickened, it can restrict the movement of these oral structures, and this can create problems for the baby. So because they are normal structures, I feel like oral ties are typically pretty controversial when you're talking to a group of providers. But the most important part that I want to iterate is that when we are getting our baby or child assessed for ties, I feel like functionality is what we need to examine or assess versus just, taking a look in the mouth, like in visualizing if there is ties or not ties, because again, these frenulums are normal structures, but I want to see how these structures are affecting the child's functionality when they are breastfeeding, sucking from a bottle, things like of that nature. So, as I mentioned, these tightened, shortened, or thickened frenulums can cause restricted movement within the mouth structures, right? So we have a couple different locations where these can occur. So we have a tongue tie, a lip tie, and a buccal tie. So the tongue tie is when that frenulum that connects your tongue to the bottom of your mouth is tight, shortened, or thickened. Another one you might have is a lip tie. So same thing, when that structure that connects the frenulum that connects the lip to the gums gets really short, thick, and tight, you lose mobility of that lip. So when a baby is getting its latch, it's not going to be able to, flange those lips out. It's not going to be able to get a nice deep latch because it's lacking that movement in the lip. Same thing goes for those buccal ties. So the buccal ties are on the side. It attaches the side of the cheeks into the gums. So this can also, if you have a buccal tie, it can create a dimple look. So what that does is that holds that cheek nice and close into the gums. And again, baby doesn't have that mobility or that flexibility in the cheek to, again, open up those lips and get a nice deep latch. So if a baby has any of the, lip, tongue, or buccal ties that we had just discussed, what this is going to do is this is just going to inhibit the baby's natural ability to get a good suck swallow pattern. So what this is going to do is it's going to affect their latch, right? So baby's not going to be able to flange the lips to get a nice deep latch. They're not going to be able to get the tongue to keep the breast or the nipple in their mouth, and that's really going to affect their breastfeeding journey. So some things that you could experience are going to be pain when nursing because baby's getting a shallow latch, or they're chomping at you instead of getting that nice rhythmical motion. If they're not getting a good latch, you're going to get air getting into the mouth, which can cause gas, reflux, colicky symptoms, and things like that. You might also notice, they have a white coat on their tongue, they're super gaggy, just things of that nature when feeding. However, it doesn't just, ties don't just affect a baby that's breastfeeding. It can affect babies that are bottle feeding. They're going to be really dribbly when they're on the bottle because they don't have that deep latch. They might still click. You might still be getting air into the sides of the mouth. And you'll also notice other symptoms, not just when feeding. So you'll notice a baby's gonna have an open mouth posture. Their tongue is low to the floor of their mouth, not sitting at the roof of their mouth. So they're gonna be sleeping with their mouth open. It could be snoring. It could be different things like that. And then you're also gonna notice kind of when the baby cries, that tongue isn't raising to the roof of their mouth, and you might be a little heart-shaped. Baby might also have blisters on the lips because they're not getting that latch with their tongue, they're using their lips instead. So those are just some of the symptoms that you might notice as a new mom if you are nursing or even bottle feeding that your baby might have oral ties or oral restrictions. It's also important to note that oral ties do not just affect feeding. So we have to think of long-term consequences if the mouth is not moving and functioning like it needs to. So you can have things like delayed speech, difficulty or picky eating, like very texture wanting different textures, not being able to move foods around their mouth, poor sleeping because they're, open mouth posture, sleeping, sleep apnea, things like that, as well as it can cause, delayed speech and other areas of those concerns as well, but more longer term. So a lot of times when a patient comes to me and they are having some of the breastfeeding difficulties that I mentioned above, they don't want to be selfish because it's only affecting breastfeeding or it's only affecting bottle feeding. We have to look long term as well as what this also could be affecting that we just haven't gotten there yet. If you and your baby are experiencing any of the symptoms that I just mentioned before, what do, right? So the first thing that I definitely recommend is if you are having trouble bottle feeding or breastfeeding or any of those symptoms I mentioned earlier, is find a lactation consultant. And one that is trained in oral ties. So they're going to help first get that feeding journey established and improved, right? Because that's most important. Make sure baby's gaining weight and make sure they're effectively transferring milk. So step one, definitely find a lactation consultant that you know, like, and trust. I have a plethora of contacts that I typically will refer to. After they do a formal evaluation and assessment, they will be able to give you a little bit more information about, what might be affecting babies' eating and things like that, and kind of what to do from there. But one of the things that I really want to stress, and it's really, really important that we find somebody who's going to do a functional assessment, right? I want to know how baby is sucking. What's their function like? I don't want somebody who's not going to put their hands in your mouth, or the baby's mouth, or who's not going to see how they're emptying the breast or how they are on a bottle. Because again, like I said, those oral frenulums, those are normal anatomical structures. Everybody has them, but I want to know if they are or are not affecting how baby can function and use their mouth. Most of the time, pediatricians are not well educated to examine the function, like I mentioned before. So, like I said, lactation consultant who is well versed in oral ties, and sometimes a pediatric dentist. So, pediatric dentist is obviously the gold standard for diagnosis and for treatment. Along with the assessment of just the oral motor function, it's also important to get a full body function. We are finding a very high correlation between oral restrictions as well as, torticollis or body tension in general, because they're all connected, right? What I want you to do right now, think about this. Open your mouth, just mouth or neck standing still. Pretty easy. Now I want you to move your neck around. It's difficult in different positions to open your mouth. So that's how important the rest of the body is to oral motor function. So it's really important we also find providers who can assess body tension or treat body tension as well. So these providers are pediatric chiropractors, pediatric occupational therapists, as well as pediatric physical therapists. So these are all providers that are going to assess body function and do the body work. So now, you've met with a lactation consultant, maybe you've been diagnosed or your baby's been diagnosed with oral ties, and you're getting sent to the pediatric dentist. So the pediatric dentist is the provider who is going to treat the ties, right? So the treatment is just a quick procedure. They use a laser and they laser down those frenulums to really create that mobility that we are wanting for the baby. So it's a quick procedure, it doesn't hurt the baby, and then they usually give you a list of stretches to do on those ties for the next 30 days, okay? But that is not the end all be all, and I never just send a patient straight to the pediatric dentist because of my experience as a patient who has had the baby with oral ties, as well as a provider. I know it's so important to address as well the body as it is the mouth. So I always recommend seeing, along with the lactation consultant, a pediatric chiropractor as well as an OT or PT before we do the laser revision as well, because I've seen the best benefit that way, addressing some of that muscle tension before, so that baby is ready to get the full benefits of getting those oral ties revised. So once baby gets oral ties revised, that again is not the end all be all. Just like any adult, once you have, knee surgery, you're gonna go to, a couple sessions of PT to regain that functionality, regain that mobility, and that range of motion. Same thing applies when a baby gets their oral ties revised. They don't know what to do with that mouth anymore. So it's really important that, again, we go back and see the OTs, the PTs, and the lactation consultants to regain functionality, get the baby sucking properly, using all of the correct muscles, and regaining that functionality. So if you were a new mom or a mom with a new baby and you are having difficulties breastfeeding or even some difficulties or symptoms with your child, I highly recommend reaching out to a lactation consultant or pediatric chiropractor so we can get baby assessed. Maybe they have some oral restrictions that we need to address or some body tension that we need to address. So if that's you and you're local to the area, please give me a call. I would be happy to help. The number is 513-463-3011.